My name is Madison Matthews. I am currently pursuing my Bachelor's of Nursing here at Utah Tech University. I had the opportunity to travel to Uganda with Robert Kagabo, which is over the public health department here at Utah Tech. So I returned from Uganda for the second time just about 3 months ago, and I have every intention of going back again this summer. When talking about tangible items and basic necessities, the U.S. has everything and more than Uganda ever will. Something that doesn't even compare is the people and the culture that they emit when welcoming guests and, quite frankly, strangers. The relationships that I've been able to build in such a short amount of time over the past couple of years is one of the many reasons that I'll continue to go back. Throughout my time abroad, we were able to gain a much better understanding of what it truly means to be a refugee and of refugee background. We were able to have in-depth conversations with many organizations and their leaders, including the UNHCR. During our discussions, we were able to learn that Uganda hosts over 1.5 million refugees, which holds the majority for all of Sub-Saharan Africa. There are 11 refugee settlements in the entire country, but most of our time was spent in Rhino camp as well as Bidi. During our conversation, we were able to discuss the process of how many of the refugees are settled into their new home. They're given a plot of land or a settlement in an already existing village. Unfortunately, the number of refugees is only increasing while the funding towards United Nations agencies are being cut every single year. Uganda is still a developing country. It is a third world country, and many of the public is directly affected and doesn't have access to many of the basic healthcare necessities that we do here in the United States. One of the biggest issues that we talked about was teenage pregnancies. In COVID, the rates significantly increased. From, I believe, March to June of 2020, there was a 25.5% increase in teenage pregnancy from girls aged 15 to 19, and there was a 366% increase from girls aged 10 to 14. So that's about 32,000 recorded cases every single month. Factors like child marriage, lack of education, support from family, and the severely low socioeconomic status all contribute to this ongoing problem. By being a part of this program at Utah Tech and being able to talk with organizations such as the UNHCR really gives you information to pursue what you want to do in healthcare, and I think that's really important.